Hi everyone. Today we have the pleasure of speaking with Mr. Cedric Morris, a non-Hodgkin's lymphoma survivor, here to share with us his journey and the critical role that proper diet plays in ensuring stable blood parameters during the treatment journey.
Thank you for having me. I'm very much happy to share my experience.
Let's start with your diagnosis. Can you tell us when you were first diagnosed with non-Hodgkin's lymphoma and the treatment you underwent?
My journey with cancer started precisely in the year 2014 on 15th of Jan when I went for a health checkup where the doctor asked me, where do you have the pain? Then I was wondering why he asked me. So during the scan, it was evident that there were 14 tumors from my submandibular gland to the abdomen. And the biggest was around 110 mm in my mesentery. So which I didn't know what was happening with my body. But then within a couple of weeks, I got the result which was told by me. It is non-Hodgkin's lymphoma, or it is in another way a kind of disease which happens to the blood. And that's how my journey with cancer started.
How did this dietary changes impact your treatment and overall well-being?
See, once I know what is good for my body, which I have in those days, which I have not got from a proper dietitian, but things evolved as my treatment progressed. And I knew what is good for me on a particular day, and based on that experience, I had very good nutritious food. I also went to the extent of cultivating little bit of those greens at my own house, so that my level of understanding about those greens also helped in the whole process of getting treated. And my diet contained of fiber and enough of protein as well as other vitamin substitutes in order to have a good blood parameters like RBC or platelets, which I never had too much of an issue during my treatment process.
That's inspiring to hear. What advice would you give to other cancer patients regarding their diet?
My advice to the people who are presently undergoing treatment in cancer like chemotherapy or radiotherapy is that they get proper advice from a dietitian in order to understand what are the main sources of nutrients which is required to withstand the bad effects of the treatment of cancer itself, because the cancer doesn't kill a person. The nutrition support, if it is not proper, then the treatment which is given will not give you the desired results. So hence, nutrition is very much vital and important in the treatment of cancer. So getting a proper advice and the overall well-being of a person is more dependent on a good nutrition.
Thank you so much. Your valuable insights and experiences, Mr. Cedric. Your story highlights the critical role of diet in supporting cancer treatment.